I'm pleased to be joined once again by Dr. Bob Gill, who's obviously working late to talk to me. How you doing, Bob?
Very well, Crispin. Good to see you.
Thank you for coming on. There's so much going on with the NHS that I had to give you a call, an emergency call, because what we're seeing is just story after story of almost what you prophesized would happen. This is one thing that people might not have known about, but this is one story that I thought was of interest. Is Alan Milburn to be given lead role in Labour's health ministry? It says the health secretary is preparing to appoint Milburn, who was a radical reformer of the NHS in his time in that post under Tony Blair, as the lead non-executive director of the Department of Health and Social Care. Um, you know a lot about Milburn. What's your take on that particular role he's got, and what does it give him access to?
Well, they're digging up the old Blair Brown team. Milburn was the health secretary in the early 2000s. He took over from Frank Dobson, and what he oversaw as a health secretary was for the first time in NHS history the outsourcing of clinical care. We already had outsourcing of ancillary services. He also fronted up the PFI deals, which saddled hospitals with um, exorbitant debts, which they're struggling to service. So he has a long history of involvement in privatization of the NHS. And when he quit as health secretary, he then went on to start up a consultancy. And I believe him and his family have profited handsomely out of NHS privatization.
So you can't really doubt that there's some sort of private healthcare link that he's got there, and this isn't a good sign, is it?
Absolutely. There's a quote I read earlier today, which reportedly he received a dividend of over 1.3 million last year for his services to a consultancy firm linked with privatization. So he is cashing up from policies that he helped push through. Most lay people would assume that if you're in public service, if you're a politician, then you should be barred from profiting from policy decisions, if not for life, at least for a reasonable period, 5 to 10 years. But what we have, unfortunately, is a political culture where this is legalized corruption. You can push through a policy, you can claim it's in the public interest, and then you leave your post and you cash up. And this is happening time and time again. And the person who's the most prolific in doing this is Tony Blair, of course, who took us to war on behalf of the United States and has profited handsomely ever since.
Yeah. It just seems so brazen what's going on. I mean, the thing that got to me in the last few days was one day I was hearing with that Starmer has won lots of investment into the country for this growth that he keeps banging on about. And I looked at these particular investors, and one of them was this company, Eli Lilly, which is a pharmaceutical company. I thought, oh, that's interesting. But then the very next day, all over the news, was this story that unemployed to be given weight loss jabs to get them back to work, health secretary to hand obese patients drugs to prevent them holding back our economy. And the company that he's saying will be providing this is Eli Lilly. So effectively, the deal was made that they'd make this investment. And I mean, you can't think other than that they were given the green light that they get a load of unemployed people to inject vaccines on. I mean, I just find it unbelievable. What do you make of this story?
Well, there's so much to unpick. It's difficult to know where to start. First of all, obesity is, strictly speaking, it's a product of so much environmental, diet-related, um, poor food, ultra-processed foods, lack of nutritional food in your diet, heavy advertising. It's generally, for the vast majority of people, it's not a drug deficiency problem, right? Now, let's assume this drug was a wonder drug, had no side effects. And what they're bringing in is a form of coercion to force people that unless they undergo these injections and lose weight, they will lose benefits. There will be an element of coercion. Now, as it happens, these weight loss injections are very well known to have quite serious side effects. Some are associated with suicide. When you lose weight, you don't not only lose fat, but you also lose muscle mass. The drugs actually induce a state of starvation. It tricks the brain and your digestive tract into feeling full up. And in rare cases, you can get permanent gastric paralysis. So people have a lifelong side effect to these drugs. And the kicker is the vast majority of people who stop the drug put on all their weight. Only this time they've got less muscle to carry around the fat that they put on. So, they're proposing a pharmaceutical intervention, which is going to be highly profitable, which does not treat the root cause of the obesity. And in doing so, they helpfully, reinforce the concept of scapegoating people. So in the eye of the sort of cursory observer to what's going on, he might say, well, this might be a good idea, get people back to work. And, the other prejudices about being fat and lazy and getting back to work. So the government is indirectly reinforcing all these very negative attitudes towards people who don't work or might have a medical health problem, painting them as burdens on society. And there is so much that I could unravel further in this just one news story. The fact that government is having to provide tax incentives and guarantees of a market to attract these pharmaceutical companies into the country. It stinks to high heaven on many levels.
I can't get my head around what you've said about the side effects as well. I mean, I had no idea of that, but the use of the word vaccine, I mean, it's not a vaccine. A vaccine's not something you can lose weight with. I mean, what's happened? People are being fobbed off with false words and
Well,
it's false science. No, there's no way it's a vaccine, is it? You can't have a vaccine that's anti-obesity.
absolutely not. But, they have abused the language to such an extent that they've normalized totally misrepresenting things. So, we were given the COVID supposed vaccine, but actually it was a modified gene therapy. It doesn't fit the traditional definition of a vaccine. What a
Right.
vaccine is, it gives you a sort of neutralized form of an infection, a virus or a bacterium, and the body mounts a defense, an antibody response to a fixed dose of vaccine. But what the mRNA did was give you the genetic cookbook to make up your own spike protein at a totally unpredictable rate, right? So everybody was in effect getting a different dose. And we know now on the back of the data coming out about the COVID vaccine, first of all, COVID was not a serious infection. It had the death rate of a typical influenza season. Secondly, the infection provided you with natural immunity. So for a lot of people who had the infection, the vaccines were totally unnecessary. And they extended the use of the vaccine for people who were close to zero risk, fit and healthy people under the age of 18, who then went on and had side effects which the drug companies in their own data had evidence for, which was kept away from the public. So the whole pandemic experience has taught us that big pharma can't be trusted. They exaggerate the benefits, they hide the harms, and our politicians are firmly in bed with these companies, and it's deeply troubling. The solution to obesity is not more drugs. The solution to obesity is look at the food people are eating and try and improve their diets and get them living a healthier lifestyle. But what this government has proposed is music to the ears of profit-hungry multinational corporations who do not respect science, who are routinely fined for fraud against the public, who pay off billions of dollars in fines, yet these fines represent only a fraction of the profits that they cream off.
Yeah, it just seems like they're trying to blind people with science, and we people have already accepted the COVID vaccine without really questioning it. So they'll take anything if they say it's a miracle drug. But the other aspect of it is he talks about moving from analog to digital. It's this kind of like we don't have to diet anymore. We can do things in some kind of Aldous Huxley scary, for me, scary way of like you just have to take a jab or something to get rid of the weight. It's all like, oh, we're in the modern age now, but that's just as I say, it's kind of blinding us with science.
Yeah,
What's your
he's
yeah, sorry.
yeah, they're deliberately confusing people. We have a natural bias to assume that new technology is somehow going to be an improvement. Only years later on do we understand that actually this did more harm than good. When he talks about digitalizing the NHS and using modern IT, what he's doing there is promising a market for the big tech companies. It's got nothing to do with provable beneficial outcomes for the patient because that evidence just isn't there. What you normally do, if you have any sense, is if somebody was genuinely representing the public interest, a politician, a leader, should be saying, present me with the overwhelming evidence that me committing to spend billions with you would actually deliver a health benefit to the patients. There is no, I've not seen any of that evidence. Yet we have all this, you know, blue sky, dream-like thinking, uh, swallowing the propaganda and the marketing from these companies who stand to cash up very handsomely indeed. And that means money that should be going for proven treatments is diverted away to these companies, big pharma and big tech companies, who then go on to donate to the politicians. This is a circular, corrupt, mutually beneficial scheme for big business and our political class.
Wow, yeah. Now that another story that came out this week is in the Health Service Journal, which is a subscription only website, but people have been able to. Some people have subscribed to get some of it to read it. But this is a story. Um, this is relating to Bath and North East Somerset, Swindon and Wiltshire integrated care services. It says private provider takes over NHS services worth 1.3 billion. A private firm has been awarded a contract worth around 1.3 billion to lead community health services for an integrated care system for up to 9 years. 1.3 billion. Um, talking about, we just talked about the analog to digital. I mean, the other aspect he talked about was community health has to be improved. We have to catch these things before it gets to hospital. So it's so important we start with the community. I mean, 1.3 billion. What's your take on that contract there?
Yeah, so first of all, I want to remind people that what an integrated care system is. Essentially, these are new legal entities. There's 42 of them around the country, which are arm's length independent organizations, which have a board that is at liberty to outsource every and all aspects of healthcare. And any money that they don't spend can be kept as profit. Now, what you have here with this contract is no surprise, because if you listen to what the privatization lobby spokespeople were saying, over a decade ago, I'll read you a quote. Dr. Tim Evans, who was a representative from the Independent Healthcare Association in 2011, spelt it out quite clearly what the NHS would become. Quote, the NHS would simply be a kite mark attached to the institution and activities of a system of purely private providers. They told us what they intended to do. This integrated care board has now decided to award this huge contract to a private equity firm. First of all, we don't know whether there was any competitive bidder. If you think about the process of outsourcing, it involves a lot of people. you have managers, you have administrators, and you have lawyers. And this is money taken out of the system, which could be spent on patient care. Then you have the contract being awarded. You have negotiations between people which may have conflicts of interest. So we have no idea that the people on the integrated care board don't have some business relations with this private equity firm. And if they did, the level of scrutiny is so minimal that all they have to do is sign a bit of paper and declare a conflict of interest and carry on. So this
Oh,
is another form of legalized corruption, which I witnessed when I was part of our clinical commissioning group, the predecessor to this current reforms that have taken place, where I was asked basically to toe the line of the board. Otherwise, they weren't interested in having me on the board. So you have a hand-picked board, which may contain people with conflicts of interest, who award no competition contracts for very vital services spanning years. What we're not told is what is the process of monitoring this contract? Who will be overseeing the quality of the services delivered? That all costs money. Now, the founding principle of the NHS was not only have healthcare available to everybody, but the basic principle was the state would own and run and employ everybody, because that's the only way you can guarantee the quality of the service you're providing. You've got to make sure your doctors and nurses are up to scratch. You've got to provide them with training. You've got to provide them with support. What this outsourcing deal does, it allows the private equity firm to decide on the staff skill mix. Yeah. It will decide on whether they grind the experienced and expensive staff out of the system. Many of those people will walk because they will see this race to the bottom in terms of standards that we've seen on many other outsourced contracts, which have ended up disastrously. So there's nothing to say that this will be any different. The other question we have to ask ourselves is, where are the unions representing these staff who joined the NHS, thought they were part of the NHS, and now are going to be transferred wholesale to a private provider? Why aren't the unions jumping up and down and pulling their hair out and predicting the loss of experienced staff and the gradual erosion of pay, terms and conditions and standards, right? Because what will happen is the nurses and carers who these people employ will either be ground out, or they will see the decline in services and leave, or they will have to put up with providing substandard care to their patients.
and the community care aspect. I mean, what is that about? What? So that's an element of the integrated care system, but not the whole thing. I'm not quite sure. They're being given they're being given the to lead community health services. Is that what does that mean?
So essentially, it's picking up things like community pediatrics, district nurses, healthcare assistants who look after people who are at home. So they're, literally in the community. But the other element of this push for care in the community is to provide cover for yet more cuts and closures to hospital capacity. So you cut beds, you then create a situation where people are forced to discharge people back into their homes, often prematurely, often dangerously, into this privatized, private equity run for-profit business arrangement, which is going to employ bare minimum staff, the cheapest possible staff you can get hold of, exploited staff, who will then incorporate these big tech fantasy solutions
Mm.
and give a picture of providing care. But actually, the humans who deliver that care will become less and less. So in effect, you replace the humans and you substitute them with uh, tech equipment, and your supervision of the service provision and the quality is diminished, because then there becomes a perverse incentive for the integrated care board to cover up failings of their chosen bidder to take on these services. If you outsourced some of your
Yeah.
work and money, you're hardly going to be the most critical judge of the services provided. So it will be down to patients and down to carers and relatives to make a fuss, because the government does not have any interest in showing their central pillar of policy is a failure. And
Right.
you know, this is a form of deregulation. We had deregulation or lack of regulation and oversight that has led to one public disaster after the other. We've had Grenfell, where they tore up housing regulations. We've had mid-staffs where the managers ran amok trying to run services without any investment and without any staff. You've had Hinchinbrook, which was a privatized hospital where the services were collapsing and the taxpayer had to step in. So time and time again, public money is being transferred to the private sector, but the public ends up picking up the pieces when they fail. We end up underwriting all the risk. You should not be privatizing any service that you cannot afford to let fail, because failure in healthcare means dead patients.
I mean, the last bit of that came out this in the last week was this story from a hospital in London, with a wheelchair docking station, up to 4 hours free of charge. And then you have to pay for the use of a wheelchair. I suppose if you're waiting for an appointment in A&E or waiting to be seen in some kind of way. Um, is that something that you predict is going to be commonplace?
Yeah, so we know that if you have to park at the hospital, you're charged through the nose for parking, but now that has become normalized. We used to have NHS funded audiology services, but they have been um, trashed, and now most people accept they go to Specsavers and buy an expensive hearing aid. If you want glasses, the NHS provision of that is next to zero, as is NHS provision of dental services. So, in effect, you shut down access to publicly funded services and to allow opportunities for the private sector to step in. And this is yet another relatively small example of that same strategy that they keep employing. You take away something, the people get used to it, and then they accept being charged for it. You know, from what I read, Prem Sikka wrote an article which said the number of people who have taken out top-up private insurance because they realize the NHS is failing them and won't be there when they need it, who mistakenly believe that somehow private health insurance is a good idea, the number of people taking that out went up by 80% in 1 year. So people can see what's happening to the NHS. They're potentially thinking they're buying themselves some protection, but they will be mistaken, because the private sector isn't interested in emergency expensive care, isn't interested if you develop an expensive cancer, because they will price you out of their premium. So this is a false insurance, let's say, for people who can see that the NHS is in rapid decline. But what I'm most hoping for is, you know, some of my NHS campaigner colleagues were optimistic enough and naive enough to believe West Streeting and Starmer were any different to the outgoing Tory party. Well, if you needed an example to shatter that illusion, you've outlined 3 or 4 of them.